Hello, my name is Rachel Meadows, and I will be speaking to you today about neuromyelitis optica, NMO for short, also known as Devick's disease or Devick's syndrome. Neuromyelitis optica, also known as Devick's disease or Devick's syndrome, is a central nervous system disorder in which the body's immune system attacks the cells of its own spinal cord and optic nerves, as well as sometimes cells in the brain. It is an autoimmune disease, which means that it's caused by the body's normal immune defenses falsely recognizing and targeting normal cells as invaders. At this point in time, the cause of NMO is really not clear. Theories kind of abound. One theory is that it's genetic in origin or that it can be caused by other inheritable autoimmune diseases. It has also been associated with other infectious and environmental comorbidities, including varicella zoster, HIV, Epstein-Barr virus, and exposure to certain drugs. The symptoms of NMO are caused by the demyelinization or destruction of the myelin sheaths of neurons, which are the functional cells that make up the brain, spinal cord, and other elements of the nervous system. Current research has targeted a specific protein called aquaporin 4 present in the cell membranes of astrocytes, which are actually the most abundant type of neuron in the brain and spinal cord. We know that aquaporin 4 plays an active role in the transport of water across the cell membrane. And in NMO, antibodies, which are a part of the body's normal immune defenses, in this case called NMO IgG, recognize this protein as foreign, attacking the astrocytes and actually contributing to their destruction. Because NMO is an autoimmune disease, there are no true incubation and prodromal stages, and those stages are poorly understood at best. The patient merely progresses from being asymptomatic to experiencing NMO symptoms as increasing damage to neurons occurs. NMO initially presents as visual changes, also known as optic neuritis, from inflammation of the optic nerve. These may present as a loss of visual acuity, loss of color vision, or defects in one's visual field. And untreated NMO can actually progress to blindness. Spinal cord damage presents as a loss of bladder and/or bowel control, as well as unilateral or bilateral weakness and loss of control of one's arms and/or legs. A percentage of patients can progress to total or partial paralysis even. NMO symptoms usually present in attacks or NMO flares, which are periods during which the patient experiences an intense worsening of his or her symptoms, and usually it requires hospitalization. In terms of diagnostic criteria, we start with a basic neurologic examination by a neurologist, of course. An ophthalmologist actually may be involved to examine the patient's eyes. An MRI, which is short for magnetic resonance imaging, can detect telltale lesions present on the spinal cord or areas of damage in the patient's brain. Tests conducted on the patient's blood look specifically for the presence of the antibody NMO IgG. Other more general blood tests may also help in determining the level of white blood cell activity in the body. And that is an MRI machine there pictured on the right. A lumbar puncture or spinal tap can provide information about the level of white blood cell activity in a patient's cerebrospinal fluid, CSF for short. And finally, evoked response tests may also be conducted by a neurologist to gather information about a patient's focal neurologic deficits. An evoked response test actually involves the physician placing electrodes on the patient's scalp and body, which then record the patient's neurologic activity to different types of stimulus. Treatment for NMO is still quite experimental and constantly evolving. Currently, first-line treatment for NMO flares is a course of high-dose IV steroids, usually solumedrol, which is pictured on the right there. Plasmapheresis is a procedure that has recently come into play for the treatment of a number of autoimmune diseases. It is used in treatment of NMO in conjunction with steroids or when steroid treatment fails. And you can see the process there pictured on the right. It's a sort of helpful to think of it as a cell washing in which the blood is actually taken out extracorporeally from the patient, out of the patient's body, passed through a big filter, essentially, that separates out blood cells from plasma. The blood cells are then mixed with a clean replacement solution and then returned to the patient. The goal being to wash the cells of antibodies and other immune mediators that are causing this inflammation and exaggerated immune response. And there are a number of other drugs used to treat NMO. Most of them focus on immune suppression. Many of them are chemotherapeutic agents, the rituximab being one. Mycophenolate mofetil, also known as Cellcept, is actually a drug that was originally designed to treat organ transplant patients so that their bodies would not reject the foreign organ. And it has been used experimentally in a number of autoimmune treatment of autoimmune diseases with success, including lupus would be another one. The good news is patients undergoing treatment for NMO can be expected to recover from a flare in a few weeks, although most with residual motor and visual deficits, unfortunately. And the difficulty in treating NMO is that the flares themselves can cause and do cause permanent neurologic damage. And then there are two varieties of NMO. One is basically one where the disease goes into remission after a flare and does not reoccur. The other variety, which is the most common, patients have recurrent flares. And so certainly recurrent flares then worsen this neurologic damage. Further prognosis. Unfortunately, current statistics lead us to believe that 50% of patients with the recurrent relapsing variety of NMO will progress to blindness or paralysis within 5 years. And it can actually even progress to death through respiratory compromise due to paralysis of the diaphragm, if that portion of the spinal cord is involved. There is hope on the horizon, though. Doctors are looking at these numbers now and looking at the improved diagnostic criteria and treatment options that they have discovered in the last couple of decades. And they really believe that they may be able to dramatically decrease the number of NMO patients that progress in this way. So, thank you very much for your time and attention.